everyone. Welcome to Wellness Wednesday with 3W. This is Beth Chase, the host of today's podcast. Well, last week, in honor of the National Cancer Survivor Day, which was, by the way, June 7th, Dr. Susan Rutherford was here, and she was talking about the 3 primary reproductive cancer concerns for women. And then she brought out how important it is and critical that for all women to not delay in getting their annual Well Women Care exams, or they shouldn't delay also in going to see their doctor if they have any certain kind of symptoms such as irregular bleeding or breast pain. So today I have with me Helen Wynn, who is the Executive Director of 3W Medical for Women, and 2 staff, Lauren and Taylor, who are responsible to assure that the patients are safe and served with excellence. So welcome, everyone.
Hi.
I'm sure you can tell by now it's going to be a lively conversation, and but we're here just simply to have that conversation. We're sitting around a table here in the studio, and we just wanted to have a talk about 3W, what they are seeing with 3W, and what kind of issues that are at the heart of some of the reproductive health concerns for women today. So, Lauren, let's start with you. Tell us first of all about your role in the clinic.
Yeah, hi guys. My name's Lauren. I am the office manager here at 3W. As the office manager, I am the first person to talk and see the patients when they come through the door. I get them all checked in, and I help assist our medical staff to make sure that the day runs smoothly and our patients are taken care of.
What is your favorite part of your job?
I really like talking to patients on the phone and being able, if they're very concerned about something that's going on, maybe they're concerned about payment or not having insurance, and kind of the sigh of relief when they find 3W and they're able to think, wow, I can get taken care of and I don't need to worry about what's going on anymore. Mm-hmm. And someone's going to be there for me no matter if I have insurance or I can't afford it or whatever. So.
Mm-hmm. Okay, so tell us about what types of appointments that 3W is currently taking.
Yeah, right now 3W is doing STI tests and treatment for patients, as well as pregnancy services in the first trimester. So free ultrasounds, free pregnancy tests if someone is concerned about that, and then our STI testing.
Mm-hmm. So the ultrasounds, what are the ultrasounds used for?
The ultrasound is after we get a positive pregnancy test to see how far along a woman is in her pregnancy and make sure the pregnancy is looking good. Dr. Rutherford can see how far along, measuring the embryo or the fetus and making sure that everything is looking good and if they need any other assistance further. And we can send the results to an OB provider that they are going to continue their pregnancy with, but we can start that out for them and help them get that process rolling.
Who performs the ultrasounds?
Dr. Rutherford does, and we a lot of times have nurse practitioners in there too, or medical volunteers to help Dr. Rutherford with anything she needs.
Mm-hmm. Okay. Taylor, tell us about what you do at 3W.
Yes, so I am the executive assistant here at 3W. A lot of what I do kind of revolves around HR, so a lot of recruiting and onboarding of personnel and volunteers, as well as kind of making sure that all of our policies and procedures are, being followed and that they are following certain guidelines, be that from the state, the city, county, or even CDC. I kind of fill a lot of these holes that we have in the organization, especially when it comes to fundraising or helping with the team. And I think that in some ways I've been here for almost 2.5 years now, so I can also act as a floater, kind of filling in positions or needs that anyone has in the clinic.
Mm-hmm. Yeah, I can attest to that. Taylor, you kind of have the role oftentimes of being what I call the glue, that holds all of this together, because it can definitely be a busy day with what feels like a lot of plates spinning, but always that woman and the patient come first. So that's awesome. So why do you think, Taylor, that it's important for women to come in for reproductive health care even during this COVID-19 crisis?
Yeah, and I mean, it really has been a crisis. I don't think anyone anticipated it to last as long as it has. And now, especially here in Washington State, we just don't know what is going to happen. We don't really, I mean, there is this 4-phase plan, but even that, there's a lot of unknowns for us. So don't delay on your health just because some of the things in our world have stopped moving, people losing their jobs and, many businesses having been closed down, it doesn't mean that your healthcare stops. Your body keeps going. Our habits continue, and your body needs to still heal. It still needs to be checked up. It still needs to have a medical professional look and say that this is what you're encountering. And the healing or sickness of our body, it doesn't stop when a virus comes in or when some other crisis happens. And I think that it's really important that a place like 3W is open right now, because we are serving those needed appointments and those needed medical attention items.
Mm-hmm. Helen, we're hearing a lot about women not coming in for health checks, especially when they're having a symptom. Mm-hmm. Why do you think that women have slowed down on getting something checked out if truly there were some symptoms going on, like vaginal bleeding or pain somewhere? Why do you think that is? Any idea?
I think that there's a lot of news going on about going outside and then going into a space where there's medical and healthcare being performed. And so there's fear around being exposed to maybe other unknown health issues that might be coming up, especially in a medical setting. And I guess I just want to relay the message that we here at 3W are taking all of the recommended CDC procedures to make sure that when you come in, you're in a very safe space to receive the type of healthcare that you need, and to not delay it. A lot of the STIs and STDs that a person might have is asymptomatic. So even if you just want to have peace of mind in the sense of, I might have it, I might not have it, where do I go to find out? 3W is the space that's been open and ready to serve you, even in the time of COVID.
Mm-hmm. And the services are free of charge, except for what?
All of our consultation and exams are free of charge with a licensed healthcare provider. The only nominal costs that you will be asked to pay are lab fees, and I guarantee you that they are very, very low. For an example, and Lauren can correct me if I'm wrong, but a pap smear here at 3W costs $18.50.
Yes.
And that's lower than your typical copay. And we don't even take your copay. We don't need to see proof of insurance. So we really, really encourage you to come in, because we're not a place that will nickel and dime you. Mm-hmm. We simply pass on the lab fees that the lab passes on to us, to you. So please don't feel like a financial burden if you come here.
Mm-hmm. And I think a really big point is that 3W does not make any money from the choices that a woman makes regarding her reproductive health.
Correct. The conversation that you want to have about your reproductive with a licensed healthcare provider here at 3W is completely free to you. We make no money off of your decisions once you leave here.
Mm-hmm. And I mean, think about it. Isn't that a much safer place? When we talk about a safe space for women to go to get tested and get information about what their choices may be regarding their reproductive health, whatever it is, for them to find a place that doesn't sell anything or make any money from the choices they make, I think that says a lot about your intentions and about the very heart of this organization. Lauren, what are you doing in this COVID-19 era to assure that the patients are safe when they come to 3W?
Yeah, so we are following all state public health guidelines and CDC guidelines. Every person that comes in our door has their temperature taken. We have them put a mask on, and all providers and people interacting with The patients are wearing masks. Additionally, we have sign outside our door saying, if you have these symptoms, don't come in. Over the phone, when I'm scheduling appointments, I ask the patients, have you had fever, cough, any symptoms of COVID-19? And have you been exposed to anyone who also have these symptoms? And if they say no, we can book them and see them. Additionally, we are doing a lot of wiping down of services. We always do, but a very high emphasis on cleaning in between patients to follow the CDC guidelines.
Mm-hmm. Okay, so that's basically what I'm hearing you say, is that everyone here at 3W follows the CDC guidelines and standards. And may I say, you all are pretty tough on that. I've seen you. I've experienced it. So
we have a video about it.
Oh, that's right. Hey, do you think you could post that video on the wellness? Okay, we'll talk more about that when we get to the end here. So, Helen, clearly 3W operates under some very strong core values. Would you please share with the listening audience just a couple of those core values?
Sure. Our first and primary core value is that we believe women are smart and that they should be empowered with the information they need to make good and consensual healthcare decisions surrounding their reproductive health. They should not be in a space that they feel unsafe, that is judgmental, and 3W can provide that for them. We do not pressure women into making any type of reproductive choice that she is uncomfortable with. Patients can walk out of here feeling that someone listened to them, someone honored their story, someone walked alongside them when they had any type of healthcare issues or past healthcare issues. That's what we're here to do. The second core value that we have is we never want to turn a patient away, in the sense of we never want a financial burden to be the hindering factor of why you don't come in to receive care. We know, especially during this tough economical time right now during COVID, that some people might be fearful to not want to reach out to a healthcare provider because of cost or fear of being judged for asking for a sliding scale or anything like that. We are not that type of clinic. We will work with you. We will make sure that you understand what the costs are up front, and then we will work with you and what your financial needs are. All we care about is that you're safe and that you're coming in and receiving the testing and treatment that you need so that you can be a productive individual in your community.
Helen, do you ever see women who tell you that their reproductive health care wishes were ignored?
Yes, plenty of times that we've seen patients come in and they can't believe that, first of all, that we are taking an hour with them for their healthcare visit. And secondly, that we took the time to really honor their past experience with other healthcare providers that might not have been the best, might not have been the healthiest. And we, especially with Dr. Rutherford, she takes her time to really listen. And when you leave here, she wants to make sure that you're an advocate for your healthcare. And that is especially important to me, since my experience has been in social work, is that we always want to advocate for our clients and for our patients to be their own best advocate. So when they walk out of here, they have the tools and even the questions to ask future medical providers, because the medical world has their own language. And sometimes if you don't ask the right questions, you won't get to the right answers. And so Dr. Rutherford really tries to listen and hear what the patient is trying to say, and then empower that patient to say, okay, these are the language you need to use, this is the words you need to use, so that the next time you go to a medical provider, you're going to get the answers that you need to make the right decisions for yourself.
Yes. In fact, Helen, I think I've already had that conversation with Dr. Sue, where she's going to actually do an episode about what are the questions that a woman should freely and consistently ask of her OBGYN or her healthcare provider. Because sometimes that we're discovering that women actually don't know what questions to ask because they just weren't educated about that. Lauren and Taylor, have you found that to be true? Like, because I know that oftentimes you interact with the patients on their way out. Mm-hmm. Okay, they've come in with a certain kind of expectation. They're probably under a lot of pressure. They're really not sure, maybe for sure if they have an STI or if they are pregnant. What is it that you find that when they leave, is there any kind of emotional transformation that you see in them?
Yeah, one patient specifically comes to mind for me. I actually was the office manager for a couple of years before Lauren took on that task. But I think of one specific patient who had been to several doctors actually. And she had been ignored for many, many years about her health care. And I remember Dr. Rutherford spending not one, but 2 hours with her for one appointment. And that patient came back a couple of times. And, this was about a year ago that we started this journey with this patient who had, no insurance. She was being ignored by so many people. And actually, that same patient came back maybe a couple months ago, and the difference in just the way that she looked, the way that she carried herself, the clear confidence that she had was amazing to see. And I think it was really touching for her to tell us that, it all began here. That process began here because we took the time. Dr. Rutherford told her to continue to come back if she had more questions to call, and she did. She called, and it was amazing to watch her learn how to advocate for herself and then to watch her put that into practice and then to come back and see the physical resemblance of how that played out for her.
Mm-hmm. Interesting. Lauren, what's been your experience?
Yeah, I see a lot of people on their way out, and I get a lot of, I'm so glad you guys are open. I'm so, this was so great. I see a lot of, lately, women in pregnancy that have insurance difficulties or because of COVID can't get into their OBGYN or established, and just feeling super thankful to have peace of mind, knowing that they are healthy and taken care of, and being able to feel like they can advocate for themselves and go to their other providers and know what to ask because Dr. Rutherford gives so much information. It's so fun to be able to work with Dr. Rutherford because patients truly are impacted and they feel like seen and heard and advocated for by Dr. Rutherford, which is really special in a provider in these day and age because it's very busy in a lot of clinics. It's very on to the next, and Dr. Rutherford never makes you feel rushed or there's another patient in line. It's always when you're with her, you're one-on-one, and she makes you feel that way.
Yeah, I think that's one of her personal core values as a professional medical provider, that she completely gives the attention to that patient and takes whatever amount of time that she feels that patient needs. So, Helen, why is it that the 3W remained open during the stay-at-home mandate when there were so many other small kind of boutique medical clinics that chose to close?
Well, here at 3W, we just felt like we needed to stay open because, first of all, we offer essential services. And we stand by those essential services such as STI testing and treatment and pregnancy services. And we felt like if we closed and you couldn't go somewhere and those services had to be delayed, where would you go? And we exist to serve this community. We exist to serve those that feel like they haven't been heard or they've been ignored or their healthcare has been delayed because of other essential services. We feel that the essential services that we can provide, you can come here and get that. And you can be seen and you can be heard. So if you have any type of health concerns right now that you feel like you just want to talk to a medical provider about, please make an appointment with 3W today, because we are open and ready to serve you.
Mm-hmm. So, Helen, in wrapping up this episode, what is the one message that you would like to leave with the women and the men who are listening to this podcast?
To do not delay receiving medical care and to make an appointment at 3W Medical for Women today.
And how do they do that?
They can visit our website, which is 3W medical.org. There's a giant book an appointment button on there. Send us a quick appointment request, and Lauren is very good at getting back to you very quickly. Many times we could see you within the day that you made that appointment. So please do not hesitate to reach out to us. Talk to Lauren, talk to one of our medical providers on the telephone to make sure that we can see you and that you're in our scope of practice. Or you can download our app, which is 3W Medical app. You can make an appointment on there. Or you can give us a call at 206-588-0311. Again, that's 206-588-0311, and you will get our lovely Lauren, who will be answering the phones.
Yeah, and they can say, "Hi, Lauren, I feel like I know you." And another way also is you do take walk-ins or not?
We do. Yes, we do. We encourage you to make an appointment. I think that's the first, and that's what we probably encourage you to do first, because we want to space out our appointments to not have a bunch of people sitting in the waiting room at one time because of COVID. So safety comes first. So please just give us a call. Even if you're in your car, give us a call and make sure we have a spot reserved for you to come in. But if you want to come in and just ask us a quick question, that's totally fine as well.
Mm-hmm. Okay, well, it's time to draw this episode to a close, and I just want to say thank you, Helen, Taylor, and Lauren. Clearly, in listening to you as we sit around this table, that your passion for providing a safe place where women are seen and empowered is so impressive. And I want to thank you, because I know that you all are sacrificing time and energy, and you're not here to make the big bucks, but you're here because you genuinely care about women. So you can find out more information about 3W by going to their website, like Helen shared a few minutes ago, by going to 3wmedical.org. That's the number 3, the letter W, and medical.org. And particularly once you get in that first page, click on the Wellness Wednesday tab, which is at the top of the menu, and that will take you to a page specifically about these podcasts. You can choose different episodes you want to listen to, but also there's a place there where you can post a question to Dr. Sue, and we encourage you to do that. Go there, type in their question you may have, and there's going to be, every once in a while, we're going to have Dr. Sue is in the house where she will be answering questions that have been sent in. So until next time, stay healthy and be well.